Hi, my name is Corey Clark, and this is my case study for DMS 4410. So, a 42-year-old female arrives in the ER presenting with painful blisters on her fingers. She had been skiing for most of the day and was concerned that she may have frostbite. A CBC panel was ran on behalf of the patient and showed an elevated white blood cell count, which is indicative of infection. The patient also presented with shortness of breath, which she attributed to an altitude change, and it should be noted that the patient reported tobacco use of 4 to 5 cigarettes per day for the past 20 years. In order to establish if the fingers were receiving blood flow, the physician ordered an ultrasound and angiogram of the hand. Here is what a normal ultrasound would look like on phalanges or digits. You would see the proximal interphalangeal joint, the distal interphalangeal joint, the phalanges, and a lot of the tendons and things like that. It should also be noted you would see blood flow similar to that shown in the right-hand corner. A normal ultrasound was not the case for this patient. It was clear that there were some pathologies and abnormalities in terms of flow that was demonstrated by color Doppler as seen here. The angiogram for this patient was also very telling. A normal angiogram is seen on the right-hand side here. Our patient's is viewed on the left. It's clear that the flow is very disrupted on the left and it is very occluded and the blood flow is not getting where it needs to go. Here's a side-by-side of the imaging results, the angiogram and the ultrasound. It is clear that blood flow is disrupted and both are abnormal for our patient. Based on the imaging results as well as the patient's history as a smoker, she was diagnosed with Buerger's disease. Buerger's disease is also known as thromboangiitis obliterans. In terms of pathology, Buerger's disease is rare in the United States, affecting 12 to 20 people out of 100,000. It commonly affects middle-aged males with symptoms presenting before 40 to 45 years of age. However, it is becoming more common in women because the population of women who smoke has increased significantly in recent years. In terms of etiology, the exact cause of Buerger's disease is unknown, but tobacco use is strongly linked to its development. Buerger's disease causes the blood vessels to swell, which results in blockages due to blood clots. The presence of blood clots prevents oxygenated blood from reaching tissues. This in turn destroys skin tissues, which could result in infection and death of the tissue, or gangrene. Buerger's disease presents in the distal extremities first and can expand to larger areas of the extremities without treatment. This is an example of Buerger's disease that was left untreated for a period of time. This is what gangrene would look like due to Buerger's disease. The most common treatment of Buerger's disease is prescribed medication to dilate blood vessels and prevent blood clots. Compression of the arms and legs is also recommended. If gangrene or other infection occurs, amputation may be necessary. Patients with this disease are highly encouraged to quit the use of tobacco to lessen the severity of symptoms. A nationwide study showed that 34% of patients will undergo an amputation within 15 years from diagnosis. There is no cure for thromboangiitis obliterans. Buerger's disease is found worldwide, but it is more prevalent in the Middle East and Far East. It should be noted that Buerger's disease is not life-threatening, but can result in severe loss of quality of life. This patient was placed on prescription vasodilators and consulted with a psychiatrist regarding switching to tobaccoless products, since the onset of the disease was contributed to her frequent tobacco usage. She also began intermittent compression of her hand with a compression glove and agreed to follow up with her primary care doctor. The protocol for scanning a hand begins by using a linear transducer with a high frequency. The sonographer will begin by imaging the dorsal side of the hand and then image the ventral side of the hand. The order of the exam goes as follows: distal radial ulnar joint, radial carpal joint, midcarpal joint, carpal metacarpal joints, dorso-radial-carpal ligament, compartments of extensor tendon. The radial artery, cephalic vein, and following vasculature should be observed using Doppler to establish flow patterns. In terms of the clinical pathway, differential diagnoses in this case included frostbite and Raynaud's disease. Biopsies are not recommended for patients with this disease. The decreased blood flow to the surrounding tissues will not promote successful healing of the biopsy site, and infection becomes more likely. Patients with this disease are encouraged to use tobaccoless products. Quality of life can still be maintained with decreased use of tobacco, vasodilators, and compression of the affected extremity. However, if tobacco use remains the same, patients with this disease are at a higher chance for amputation. Patients with Buerger's disease are encouraged to avoid cold weather and stay active to promote good circulation throughout their body. Here are a list of references that I used to create this presentation.